Joining us now is MSNBC medical contributor and former Obama White House policy director, Dr. Kavita Patel. Dr. Patel, thank you so much for joining us. This is being described as an aggressive form of cancer. What does that mean? How common is it? How easy is it to treat?
Yeah, so the kind of cancer, just a Gleason score of 9, which we can break down how they get that score exactly, indicates that it is not only aggressive, but it can come on somewhat suddenly. It brings questions up of like, when was the president's last exam? Or if he had any prostate screening, which I would imagine at some point recently he has. So we know that this is 1, aggressive, 2, hormone responsive, which is a good sign. And that means that he can have what we call androgen depriving therapy to kind of take away and counter some of the interaction of what might be making that cancer grow pretty aggressively. That all in all leads to, I think, just a combination of treatment options. That's why he's consulting several doctors. In terms of how common, this is a more rare form. It is more aggressive. That spread to the bone, it doesn't say which bone or which part of his body, but I imagine we'll be getting some of those details. I think all in all, the road ahead is going to be tough. When people go through treatment for this type of grade of cancer, it can be months and months to even 2 years. And long-term survival, given what little we know, and I'm just going based off of the statement that we have from the president himself, survival rates can be anywhere 5 years to about 20 to 30%. And I think all of us in medicine have seen cases all over the map. So he's actually pretty healthy going into this, and that should hopefully be a good prognosis for him.
So even though it's spread to his bones, it's still
believe it or not,
very treatable?
Prostate, I know that sometimes that kind of thinking of, well, if it's spread, then it's far gone. Believe it or not, the advances in therapy and the fact that it's hormone responsive, which I think is part of why they put that out there, that there's actually not only a plethora of treatment options, but this is something, in fact, even at this aggressive stage of cancer, what I've seen with when people unfortunately have a serious illness, it's not from the cancer, it's from something else. So this is something that we'll be watching very carefully to see how they put a treatment plan together.
Can I ask you about the diagnosis? Because I assume as somebody who was just leading the office of the presidency,
right,
this was somebody who was probably checked pretty regularly.
Yeah.
And it's only been a couple of months. I'm sure he's probably gotten some routine physicals as well. But how often is somebody screened at that age for potential prostate cancer? And more importantly, the fact that they're identifying it being so serious, right, after him noticing urinary symptoms, right, just earlier in the week, because they said he came in for treatment for urinary symptoms. By Friday, he was diagnosed with prostate cancer.
Yeah, that presentation of kind of those urinary symptoms is not that unusual. That's actually usually how we kind of find, not necessarily prostate cancer, but that can be how we detect a more aggressive form of prostate cancer. A patient will have symptoms that come on pretty suddenly. But to your point, Eamon, about one would imagine, I did go back through his publicly released medical records and did not see the prostate-specific antigen, which is one of the blood tests that can be used to detect prostate cancer. I did not see that publicly revealed. He didn't have his entire physical down to that breakdown. One would imagine he's had that. Now, at that age, anybody that of the president's age, we kind of have like a risk-benefit analysis about whether or not we screen. If someone is healthy, which, again, he's very healthy from a cardiovascular kind of overall assessment, he would fit into probably that criteria of someone that I would say, Mr. President, you know, this is part of what we would do is routine screening. But I have seen cases where you do have a clear prostate-specific antigen. It's not perfect as a screening mechanism, and then you do see an aggressive form of cancer.
But to go back to the issue of the screening, the fact that it wasn't publicly released, does that mean it was tested but not released, or
Possibly.
the fact that possibly?
Because I did see that they had released cholesterol. They would release certain.
They had gone to something very granular, but they didn't do it for this one.
It's possible. Yeah, possible. That's what. Unfortunately, that's what. It's hard to imagine. Right. Really difficult to imagine he hasn't been screened.
Can you break down for us the options ahead of the former president and his family right now? What are they likely considering this weekend?
Yeah. So the score kind of helps with what options he might have, and just because who would understand what a score Gleason of 9 means without any frame of reference? So the highest score is about a 10. They get that score by taking kind of biopsies from the cancer, looking at the cells under the microscope. And prostate cancer cells, when they look healthy and normal, look one way. But when you see cancer, you see a bunch of different kinds of cell appearances. They take the appearance of kind of the two most typical cells, add that number together, and the highest you can get with a combination is 10. His was a 9, but it's also hormone sensitive, so it does indicate that it's aggressive and spread and pretty high grade. Treatment options then pursuing from that can be a combination of radiation, surgery, chemotherapy, and of course some sort of androgen deprivation therapy, which is in response to the hormone sensitivity.
Is there anything that you would take off the table in terms of treatment for somebody who is 82 years old?
No, the surgery might not be an option for him because it can leave him with more symptoms. We try to really sense the fact that, you can do some things that make things worse.
Right.
So I think that's exactly why he's getting probably multiple opinions and not unusual. And whenever you tell a patient they have cancer, no matter who it is, that's the only word they hear.
Yeah.
And so it does take some time.
Of course. All right, Dr. Kavita Patel, thank you so much. Greatly appreciate your insights on this. We'll be talking to you throughout the course of the evening.